the report, Government Programs Supporting Those in Need, that was issued in May 2015. The Office of the Auditor General had previously assessed in October 2018, and it was the subject of a PAC hearing in January 2019. So that is a report that we are going to be examining this morning, and so at this point I will turn things over to the Auditor General and invite her to make an opening statement.
Thank you, Mr. Chairman. Good morning to you, members of the committee, colleagues and the listening public. Thank you for allowing me the opportunity to make some opening remarks, and I'll add to the introduction you've just given, Mr. Chairman. So the follow-up report...
I think maybe appropriate for us to invite the witness to come in at this time.
Oh,
yeah,
sorry.
So my fault, and I apologize, but Paige, would you please allow the witness to come in? Good morning, Ms. Echenike, and welcome to the committee. Auditor General.
Thank you, Mr. Chairman, and good morning again. Following on from the Chairman's introduction, I'm pleased to make some opening remarks. The report that we're considering today at today's hearing now relates to our report in May 2015, which is about government programs supporting those in need. When we did this report in 2015, we found there were a dozen welfare support programs, and we made 12 recommendations around strategy, around policy, around gaps in criteria, around overlaps in provision, and around, most fundamentally, the poor Persons Relief Law, which was dated back to 1997, and we found in urgent need of updating, but after a strategy had been delivered. So 12 recommendations were made. In February, March 2016, there were a series of witness hearings held by the Public Accounts Committee at that time, and evidence was heard from Ms. Doreen Whittaker, the Chief Officer, and several other senior officials. In June 2016, the PAC tabled its report in the then Legislative Assembly and added an additional 2 recommendations of its own. In July 2017, we published our first follow-up report on past PAC recommendations, and at that time we assessed the progress on the recommendations made in that report as read, limited progress. In August and September 2017, the PAC took evidence again from Ms. Doreen Whittaker, the Chief Officer, and other senior officials. In March 2018, the PAC tabled its report in the Legislative Assembly and made a further 3 recommendations, taking the total up to 17. In June 2018, the government minute was published, and you'll see the responses are given in the appendix to the follow-up report. In October 2018, we did a further follow-up report on past PAC recommendations, and in January 2019, Chief Officer Echenike, who had taken over from Chief Officer Whittaker, then attended the PAC witness hearing along with her Deputy Chief Officer and other senior officials. In April 2019, a further 4 recommendations were made by the PAC, taking the total up to 21, and that was tabled in April 2019. As of today, we've done a further follow-up, as you've alluded to in our recent report, Mr. Chairman, and we continue to assess the progress made on the series of recommendations in our original 2015 report as read. Very limited progress. I have with me Miss Angela Cullen today, and we'll be happy to assist the committee. Thank you, Mr. Chairman.
Thank you, Auditor General. I think I'm going to go ahead and kick off the questioning of the witness this morning. So welcome once again, Ms. Echenike. I guess I got to ask the, very broad and open-ended question here is, why such a delay? What are the reasons for the delays in the ministry or the department, NAU, in implementing the recommendations of the Auditor General and the Pac Recommendations? Can you share with us what's really going on here, since it is 2015 since the original report was done?
Good morning, and thank you, Mr. Chair, for giving me this opportunity to come here today and to be able to share some information and offer clarity on some of these pieces. If I may give my full name and my existing title at this point. My name is Teresa Echenike. I am the Chief Officer for the Ministry of Youth, Sports, Culture and Heritage. As it relates to the question, we understand and we appreciate, yes, there are delays, and when we looked at some of the pieces of work that had been done prior to my coming into the ministry and the other senior managers that also joined the ministry, because let me first say that that particular ministry went through a significant change in management over the process of late 2017 and into 2020. So they were pieces that we recognize internal to the ministry itself. We were trying to equip ourselves to ensure that we were able to address all of the concerns at hand. With that said, again, we appreciate the recommendations that were made. We would have loved to accomplish some of them in a more timely manner, but we had to take into consideration several things. Manpower was one of those aspects that we had to take into consideration, but also the sensitivity of the subject area that we were looking at and focusing on. We did not want to be hasty in making drastic changes to that organization without doing some very in-depth and thorough assessments on certain areas. Although we did not have the opportunity to finalize and to establish the overarching strategic plan for that organization, there were aspects from an operational perspective that we did put focus on to try to enhance the services and to ensure that the clientele was benefiting from it. So again, we understand, we appreciate the concerns about the delays. In an ideal situation, I would have loved to come here today and to have said to you, we have accomplished everything. That is not the case, sir, and we are hopeful that some of the pieces that we started, there were some significant pieces that we started, will be continued by the existing chief officer. Needless to say, unfortunately, the circumstances with COVID also redirected our focus significantly away from some of these projects.
Thank you, Ms. Echenike. I guess, the report itself being so, having done so long time, if I remember reading the information we had, I think you came before the committee in maybe 2019 when they took further evidence, and I read that you made certain commitments to get things done. But, I mean, it just seems to me that basically this is a 6-year-old report, and literally, if I may be so bold to say, very little really has been done. And how do you respond?
Mr. Chair, again, I don't think that this is a subject area where we wanted to be extremely hasty, and especially when it came to legislation itself. We worked diligently to ensure that we had a group looking at the revision of legislation and ensuring that we had drafted regulations in place. That process was supposed to have moved. When I came in and gave my information in 2019, we were in the process of doing that and had made significant progress. The intent was to move out to consultation, and again, those pieces were the areas that were delayed as a result of COVID. The legislation itself was a major driving factor with some of the changes that would have taken place within the organization to guide processes and to better establish services. So that was a key component that we worked on when I came into the ministry and placed significant focus on that. It is an aspect of work that I'm sure you will appreciate, takes time, and it has to be a situation where we can see the benefit of changing the legislation and enhancing services, and the information as it is now, the drafted bill and the drafted regulations have been passed on to the new chief officer with the hope that the consultation and the finalization of those pieces will be completed. But that was a critical piece for us with regards to moving and changing some of the processes within that organization. Because of the law being so outdated, it was not clear guidance from the law to really guide that department. So those were some of the challenges that we were faced, sir.
I'll go ahead and open open up for questioning from other members of the committee. Recognize the member from West Bay Central, is it? Or West Central? Okay, thank you. No, if you wish to make follow-up questions, you can, or you can move on to directly into the next session. Or perhaps I might ask then if there are others who have follow-up questions with regard to this. Okay. All right. Well, if you have follow-up questions, do so, recognizing too that the member for Savannah as well has follow-up questions.
I just need to make it abundantly clear that my role as the permanent secretary under the social development, I am able to ask questions, but I will be guided by the chairman on this matter. Thank you.
Thank you, member for Savannah. Yes, I think we do recognize that you are the parliamentary secretary for the now ministry that has oversight for for these programs, and I think my view is, and we've had some discussion about this, that the report itself really predates you, it predates us, everyone in this room. And so it's perfectly acceptable for you to be. I don't see any conflict whatsoever with you being able to question a witness here this morning, since it does predate you, as well as the rest of us all.
Thank you, Mr. Chairman. I appreciate that response, seeing that this role that I'm now involved in is part of my passion.
Thank you, Mr. Chair. Good morning. Good morning to the witness. I'll get started with strategic direction, but I'll just do a little bit of background reading for the audience so that they can have an understanding of the questioning. So paragraphs 17 to 20 of the Auditor General's 2015 report states that the government did not have a coordinated strategy and priorities for providing social assistance. The Office of the Auditor General found that the social assistance programs had evolved on an ad hoc basis over the years, based on the responses of governments to particular circumstances and pressures, and there was no overall strategy that sets out what the government wants to achieve and that guides the provision of social assistance. The first recommendation, the Office of the Auditor General recommended that the government should develop a coordinated social assistance strategy, including clear priorities and the specification of desired results, to provide overall direction for planning and delivering social assistance and monitoring the results achieved. The original management response agreed with the recommendation but did not provide an implementation date. In the government minute of October 2016, the ministry reiterated its agreement with the recommendation and stated that an outline business case had been prepared, which included this recommendation within its scope. In response to Recommendation 3, the ministry stated that subject to an additional resource being provided, they expected that the strategy would be implemented in the 2016-17 budget year. Later in August 2018, the Office of the Auditor General met with the ministry to discuss progress. At that time, ministry officials stated that they were in the process of reviewing data, statistics, and research to inform the development of a strategy for social assistance, and an internal working group had been developed to take forward this work during the remainder of 2018. The ministry also stated that the strategy needed to be developed first to support the implementation of all of the other recommendations. So I just want to stress that, I think that's something that I want to point out, which is that the strategy first needed to be developed before we could even go into talking about the legislation. In evidence to the Public Accounts Committee in January 2019, ministry officials stated that they had developed a strategic framework for social assistance that included a mission and specific and broad goals. This would help provide direction and be developed further. A copy of the draft framework was submitted to the Public Accounts Committee at that time. As at June 2021, the ministry provided an update, which is reproduced in the Auditor General's 2021 report. The ministry's response does not specifically mention the development of a strategy for social assistance. So my first question to the witness kind of ties in with the first question that the chairman asked in relation to the progress with this strategy for social assistance. Can you please, I guess you kind of already indicated that there were some delays, and you also indicated that COVID had something to do with why we haven't gotten anything implemented as yet. But looking at the chronology, this was presented back in January, and COVID didn't happen until March of 2020. So that gives us a full year. So I'm just wondering if you could elaborate a little bit more on exactly what happened in that period that would have prevented the implementation.
Through you, Mr. Chair, some of the pieces that we looked at and took into consideration, and it was driven by the framework that we did establish, was the importance of us going into a process of in-depth consultation. Needless to say, it was not a situation where we felt we could accomplish all of these pieces specific to one entity. It had to be extremely broad because the clientele that we were working with were covering so many other aspects within the public and private sector that it was important for us to go through a process of in-depth assessment and consultation. A working group had been established to do some of those pieces, and again, the frameworks were guiding this process. We also recognize that it was important for us, while doing some of the pieces from a strategic perspective, that we started to definitely work on the legislation itself, because that would be a driving factor behind the implementation of a number of processes within the two organizations that fell immediately under us. So although they were ongoing pieces of work done, the strategic process was not finalized. So changes were made from an operational perspective, and they were operational pieces that were also looked at and taken into consideration that tied in with the framework for the strategic process itself, but the strategic process was not finalized.
Are you able to elaborate a little bit on what those changes looked like between that period? Just curious to just trying to understand and also help the public understand the lengthy delay.
So some of the pieces internal to the two entities that worked with us, some of the pieces that we were looking at was how that collaboration could better take place between those two entities to enhance services. Some of the changes that were made was having social workers actually partner and be present at NEU for intervention services for those significant repeat persons that were coming into the system, because again, we were realizing that persons coming into the needs assessment unit were not always coming in there only because they had financial needs, but they were some other significant needs that had to be met. So we were looking at the services from a broader perspective and looking more at that in-depth intervention that could have been offered. So that was one aspect that we looked at, we took into consideration. We were also working with the Ministry of Health because we recognize that a piece of key legislation that was under their ministry was also guiding the process in terms of persons that required indigent medical services. And again, we were working along with that ministry to ensure that the changes that they would be making within their legislation would have a positive impact on our day-to-day operations and the timeliness and the suitability of persons getting indigent medicals. We also looked at the pieces that were focusing specifically on our aging population. We recognized that we had a significant amount of the aging population coming into us for services, and as a result, we wanted to know that we were meeting their needs in a very specialized manner as opposed to taking them from a very broad and general perspective. So there were a number of pieces that we were working on that was tying into the framework, despite the fact that the framework itself or the strategic process itself was not finalized. They were aspects that we were working on, and again, working on the legislation, the drafting of the legislation and the regulations to ensure that it was with the hope that when the strategic process was finalized and all of the consultation was completed, that we would be a bit further ahead because we would have worked on the legislation and some of the operational pieces at the same time. I hope that helps answer some of the questions.
Thank you. It helps with understanding a bit, especially for the listening audience, because many persons have lots of concerns with the delays, and having this framework in place would essentially change the lives of our very most vulnerable. So I just wanted to get some clarity on that. Thank you.
members down south.
Thank you, Mr. Chairman. Through you to our witness. You mentioned that there was an internal working group that had been developed to look at the strategy, social assistance, the strategy for social assistance. Can you indicate who that working group would have been made up of? Public and private sector reps, or can you just indicate?
Through you, Mr. Chair, that particular group was mainly an internal working group that was with the entities and ministry representation. As need be, we then pulled on external bodies depending on the subject area that we were having dialogue on at that particular time. But it was about the internal bodies looking at some of the operational pieces and looking at the areas that was felt needed to be addressed as matters of priority. So it was a makeup of ministry and departmental staff that fell under that particular ministry at that time, which was community affairs, and then pulling on external bodies as necessary.
My second question then, in terms of including other government ministries, I think health would also be an area that you should include in that working group. Were they also considered?
Through you, Mr. Chair, as previously indicated, we did have numerous meetings and consultation with the Ministry of Health, because one of the significant pieces that we were focusing on with that internal working group was the indigent medical aspect. And so we pulled on the Ministry of Health as and when necessary to see how we could best enhance those services. But the piece of legislation that fell under that ministry also guided some of the processes, and so the two had to work hand in hand.
So is that internal working group still current?
Through you, Mr. Chair, unfortunately, I'm unable to speak to that because this subject area is no longer my responsibility. I am hopeful that the chief officer now responsible for those subject areas will be able to address that.
Thank you, Mr. Chair. Good morning. Chief Officer Echenike. In regards to the indigents and medical, what is the process, or was some of the recommendations that you were working on with this strategic group was to tighten the arrangement between NAU and the HSA in terms of medical emergencies? What was anything done to try to speed up this process?
Through you, Mr. Chair, matters that were presented as urgent matters through HSA was indeed handled as urgent. We relied very heavily on the guidance from HSA on these matters because, needless to say, no one within the NAU services had a medical background. So a lot of the pieces were driven through the doctors and the medical practitioners. I think that it's important for us to recognize and to understand that the aspect of work that NAU did and contributed towards that process was just the assessment process to help guide and determine suitability, but they did not have the final say. A lot of the pieces were driven from a medical urgency, and that came through HSA. Again, the importance of us having the Ministry of Health revise the legislation that guides that was because they were decision-making pieces, and they were external entities involved with that process that was felt unnecessary, and it was also becoming very time-consuming. And so to the funding and some of the final decisions were with the Ministry of Health, and then we had the Ministry at that time of Community Affairs that were contributing to the assessment component. It was not strategically very well structured, but it was the way that the legislation had it outlined. So the driving factor to making some of those changes were to ensure that the legislation itself would need to be revised. Information was provided to the Ministry of Health to try to guide that process. And so as a result, we were leaving some of those pieces with them. But internal to us, what we did make an effort to do to try to ensure that these matters were not disadvantaging the clientele, we tried to extend the length of time that persons were placed on indigent medical. So if it was a senior that their circumstances, their medical circumstances were not going to change, we would not have looked at the recommendation for them getting 6 months, but we would have made it for a significant longer period in an effort to not disadvantage them. So some of these matters were dealt on a case-by-case basis, but indeed it was necessary for us to work very closely with the Ministry of Health.
Thank you very much, Chief Officer. Mr. Chair, if I may, you mentioned something there just now, and I duly respect that you're not the Chief Officer in this area anymore, and I'm trying not to drill down too hard, but I would really appreciate if you can try to help me and guide the public as to where it is now in terms of, well, two things, or when you left. You said something just now in terms of seniors and length of medical, whether that's by cynical or otherwise, in the length of time. You said something in regards to 6 months or longer. I'm wondering if it's a senior, why are we giving them a expiry date, knowing full well that that their situation may not change?
Through you, Mr. Chair, again, those were some of the adjustments that were made in terms of looking at extended the period of time depending on the individual circumstances. So if it was a senior and if they were pre-existing medical conditions that we did not anticipate change with, we did extend it for a significant period of time. Some of them were 3 years and some were longer. Again, it is not normal that we have these services on an open-ended basis because circumstances may change, and so it is a necessity for these services to be reassessed, and so that's why it's important that some of them have specific timelines on them.
Yeah, Mr. Chair, thank you, and thank you for that answer. I think what really happens is, over the years, especially when it's extended and if it's a senior, my experience with this situation is that it's a bit of a humbug because if they get it for 3 years or more, they tend to, rely on that they have a card, and when it expires, then it becomes, I think they need to be reassessed. Am I correct? Do they need to be reassessed?
That was the normal process, that after the expiration of the coverage, that they would be reassessed to determine whether their circumstances has indeed changed or not.
Thank you for that answer. In terms of strategy, Mr. Chair, I know that, and I'll just go ahead and ask the question at this time in terms of district focus. And I know the department, possibly before you left, that they were doing some district visits. And I'm constantly reminded that one of the fastest growing districts is in Borden Town. And I'm wondering, and in fact, my constituency is the largest constituency, why we haven't thought about trying to get a centralized location that would service the eastern districts. Most of the persons who rely on this assistance normally have to either get a ride there, get a taxi, get a bus, and they really don't have the money to get to Georgetown. These are some of the complaints that I've had over the years. And I'm still baffled as to why they hadn't found an office in the middle of the country to try to service the eastern districts. I think this would be more of a help to NAU than a hinder. I know it was something there at some point and then it was moved, but I think you'd be able to drill down and a little bit better if you had a centralized location in the eastern districts.
Through you, Mr. Chair, I'm seeking clarity if the question is about the services being extended to the districts.
No, it's about the convenience.
And through you, Mr. Chair, what I will say in regards to that is that we recognize and we so appreciate, especially for our seniors, that it's not always convenient for them to have come to our general main office in Georgetown. That is why the district visits started. We were running that prior to my move to another ministry. We were running that as a pilot program to see what the true needs are and what the uptake was by the officers going into those areas. So that was a pilot program that would have driven and would have been able to allow us to advocate for offices within other districts. I am sure you will appreciate that from a cost-saving perspective and knowing the budget, the tight budget that we had, we were very conscious that we could not open offices in all of the various districts. But as much as possible, we tried to, for the convenience of the clients, to have officers do visits in the districts. And that would have guided where the needs and demand truly was coming from, and how we then would need to further develop our services. And then, of course, for the aging population that was extremely active and more than capable of coming out, we had established a center that was specific for the aging population, that they did not have to go to NAU main office and be a part of the general population. So some of the pieces were in play, and it's been passed on to the new chief officer, and I'm very hopeful that they will continue to develop those pieces.
I just had one final question through you, Mr. Chair. Just going back to the strategic direction, I was just curious if you could advise, then going back to the strategy. I understand all the delays now. So are you able to then advise us if the strategy part had been completed prior to your handover to Chief Officer Bush, or if that's something that is still ongoing?
The general framework was what was handed over, with some of the operational pieces that were critical because we saw them as priorities to meet the need of the clientele, and it was tying in with the strategic process. So to answer your question, it was only the framework itself and then some of the operational pieces that had been developed or had been started that was handed over. And that was inclusive of the drafted legislation and regulations.
Thank you.
Thank you, Mr. Chairman. Through you to the witness. You spoke to the senior center that's located in Georgetown that would accommodate and facilitate our seniors. Is that operational, or should I leave that question for the chief officer responsible that will be appearing this afternoon?
Through you, Mr. Chair, I left it operational. I cannot answer to the existing circumstances, so perhaps the chief officer that's coming in this afternoon will be better equipped to speak to that.
Before we move on to the next section, then I just have one follow-up question, more of a personal question for you, given your time there. But NAU and the accessing of services from the unit, you hear complaints all the time about it. It's a very daunting task, and it's very time-consuming, and it causes a lot of frustrations. And it does not appear to ever be a very simple process to be able to do it or to access the services and programs that you provide. What are some of the things you felt could be done that would, in your time there, that would allow for a better experience with the clients who are in need of social assistance?
Thank you very much for that question, Mr. Chair. That's $1 million question. I think that there are several pieces that I would like to focus on and take into consideration, and I am very mindful that time might not allow me to really in-depth answer that question, because I just feel that it was so much that we could have continued to work on and develop. I don't feel that it should have been done in a hasty manner by any means, but I felt that with ongoing assessments of the services and collaboration, we definitely could have seen a lot more changes come about. What I will say to you at this point, welfare services, as it is known internationally, is a very challenging subject area. I don't think that it's any one jurisdiction that has it right. And so for us here, it's extremely unique, and we had to look at it very, very carefully, because we were taking a lot of aspects into consideration. We had a growing, aging population that services had not been properly planned for. They did not have pension when they were working. So it made that group of persons then, at this point, become dependent on the government system. I want to, out of respect, extend my gratitude and appreciation to the NAU staff. Yes, we had the complaints, and yes, there were times when persons felt that services did not always go the way that they wanted, but the team there worked really, really hard to try to ensure services were met. And I have to put balance to this, sir, because there are many times when reports would come to the ministry, and when we would look into the circumstances, they were very valid reasons why the individual did not receive services or why there was a delay in services. So it was not always a negativity on behalf of the organization, but it could have been other deciding factors. I think that other areas that is extremely important is that we do not look at this area as a financial handout entity, but that it is seen from a social perspective, and it will be extremely important that you have qualified social workers in that organization to ensure that the overall needs of the individual is being met. Those were some of the things, again, that would have come out in as a part of the legislation, and we were hopeful that some of the job descriptions would be able to be further developed, because it was not only about just the financial assessment component, but what were the holistic needs of the individual? What did we need to do to truly intervene and to bring about changes in individual lives? So I think that the first step to that was having DCFS and some of the social workers work closely with that organization. That was the first step, but that was just in the beginning stages. So there's still a lot to develop. There's still a lot to take into consideration. I have full confidence that the minister responsible for this subject area will drive these pieces forward, because I know how passionate he is about them, and he also worked very closely with us in community affairs. So like I said, that was $1 million question, sir. It's a lot that we could have continued to develop to try to enhance services and specialize services, and it was just at a beginning stage.
Thank you. Member for East End.
Through you, Mr. Chair. Good morning, Mr. Chiniki. There's a general premise, especially in the East End constituency, and I've experienced the same sentiment from other members of our community, of what they see as disparity in how they as Caymanians are treated at the NAU versus other nationalities. How do we dispel that and assure the Caymanian public that we're doing what they can to assist them?
I think through you, Mr. Chair, I think sometimes we have to be very careful, because...
Ms. Echenike, can I ask you to speak a little more closer into the microphone? Not able to hear you properly.
Thank you, sir. I think that we have to be extremely careful, because we're bearing in mind that sometimes persons are speaking from their perception, and we are very mindful, again, knowing some of the concerns that have come through the ministry. When I was the chief officer, we recognized that emotions were really high. And so it's not about the nationality, it's not about the individual, it is about overall consistency in our approach. It is ensuring that we are allowing cases to be assessed, sometimes on a case-by-case basis, but still being guided accordingly by clear guidance and legislation. I think one of the other pieces that I want to emphasize is the misunderstanding that many people have that any and everybody can just walk in to NAU and obtain services. The priority and the criteria was for Caymanians to obtain services, and that is where focus have been. So the majority, unless they were exceptional circumstances in regards to who is receiving services through NAU, is our very own Caymanians.
Thank you.
Member for Georgetown South.
Okay, Mr. Chairman, through you, we're moving on. And our next line of questioning is on the objectives for and results from social assistance that's covered in the Auditor General's May 2015 report. Through you to our witness. Paragraphs 30 to 32 in the report reports that social assistance programs do not have clear objectives that set out desired results. The OEG found that clear objectives setting out what is expected to be achieved had not been specified by any of the social assistance programs. There are no performance indicators and no processes were in place to measure the performance of any of these programs. Recommendation 5, Auditor General's Office recommended that the government should set clear, realistic, and measurable objectives for each social assistance program to provide a basis for assessing its performance. The original management response to the recommendation stated that the ministry had policies in place for some payments and was using eligibility criteria approved by the Cabinet for other payments. The ministry also stated that it was preparing for Cabinet approval proposed revisions to eligibility criteria based on an internal audit in 2013. However, the response went on to say that the NAU was severely understaffed and the recommendation could not be implemented without additional resources. In the government minute of October 2016, the ministry stated that revised criteria for assessing applications for assistance for seamen had been approved by the Cabinet. Further proposed changes were with the minister for consideration, and a policy decision was needed in relation to insurance for seamen and veterans. The response reiterated that additional resources were needed to implement the recommendation. In August 2018, the ministry stated that the implementation of all OAG recommendations were dependent on the development of a social assistance strategy. And here again, it's all about the social assistance strategy in order for any of these recommendations to be considered. As of June 2021, the ministry stated that NAU had received staffing and support to accommodate the transition of seamen and veteran services. However, it also stated that the intent for these services to be managed by staff at the senior center that I spoke of earlier, but it was uncertain what direction the responsible ministry wanted to take. My question to our witness, Mr. Chairman, is, has there been any progress in developing clear, realistic, and measurable objectives for social assistance programs?
Through you, Mr. Chair, in some aspects, yes, there were clear objectives developed. We also took into consideration and looked at existing policies that we had control over improving. We again were mindful that some of the aspects in the legislation itself and in the regulation was going to drive these areas. And you made mention of the seamen and the veteran services, again, in an effort to ensure that those services were not immediately added to the responsibility of NAU. We continue to have that process through the ministry itself, but we did revise the guidelines and the policies that spoke directly to that. The intent was for the NAU then to gradually take over that service as a part of that senior center, and additional staff was allocated for that particular service.
Through you, Mr. Chairman. So can the witness indicate whether at that time you had adequate resources?
We had increased, through you, Mr. Chair, we had increased our resources, and we were continuously assessing the process to determine whether or not additional resources would have to be included in the upcoming budget cycle, because we were looking at expanding services and looking at specialized areas. We had some additional staffing to accommodate that, but as the need grew, if it was based on some of the pilot programs that we would have to expand further, then additional resources would definitely have been necessary, but it had to be continuously assessed and revised, and from budget cycle to budget cycle, the intent was, are we utilizing the existing staff members to their full potential, or do we need additional staffing? And it would have been at that point that we would have made increases to the staffing or not.
Thank you, Mr. Chairman. Just moving on then to the results from social assistance programs. Paragraphs 22 to 24 report that the results achieved from the social assistance programs are not measured, monitored, or reported. As a consequence of the lack of clear objectives and performance reporting, there is no effective accountability for these major expenditures. Recommendation 3, the Auditor General's report recommends that the government should develop the means to measure and monitor performance and to provide the Parliament with regular feedback on the results achieved by social assistance programs. The original management response to the recommendation stated that the ministry agreed with the recommendation and that it would form part of the coordinated social assistance strategy. However, as above, no date was provided for implementation. In the government minute of October 2016, the ministry repeated that they should form part of the strategy and that all agencies involved were expected to develop mechanisms for monitoring, evaluating, and reporting. The ministry also stated that subject to additional resources being provided, they expected that the strategy would be implemented in the 2016-17 budget year. In August 2018, the ministry stated that the implementation of all OAG recommendations was dependent on the development of a social assistance strategy. As of June 2021, no update was provided. Can the Chief Officer state what the outcomes expected from social assistance programs and how these will be measured and reported?
Through you, Mr. Chair, the outlines as it related to specific services through our entities were taken into consideration as a part of their outputs. We recognized and we appreciated that the monitoring and the evaluation laid very heavily on some of the statistical pieces that were lacking in the organization. And one of the areas that we looked at further developing was the database to help us continuously gather information and to be able to truly monitor trends and know the direction that we needed to have further development in. That would have also allowed us to get a better indication of some of the client numbers that we were being faced with. Were there any increases to those clients, and where the needs were for further growth and development. The review of the database started, and there were adjustments made to the database to help with that process. That was one of the areas that we worked on and made adjustments to. I think that it's also very important that I mention, since I've indicated the database as an aspect for us to gather information and to monitor some of these areas of work, that it was, although we've made adjustments to the existing database, it became very obvious that the existing database was just not adequate to meet the needs of that organization. And so the next step was not to invest any more with trying to advance that database, but to look into getting a brand new database that would help us with the monitoring, the evaluation, the statistic components. So those were some of the pieces that we had started to work on.
Through you, Mr. Chairman, to the witness. So in terms of the database, have you all procured that, or is that still outstanding? Because bear in mind that this was back in 2015 report, so I'm just, based on the time lapse, what is the position with regard to the new database?
Through you, Mr. Chair, I am most grateful to the reference made to 2015, bearing in mind that I did not join the organization and take up post of chief officer until 2018. Some of the pieces I found coming into that organization, and I appreciate some of the works and consideration was done prior to me coming in. As I indicated, on arrival, what we looked at and took into consideration was trying to advance and further develop the existing database that was there. It was understanding, after we went through a process with an external entity, that despite efforts to upgrade the database, it just was not meeting the needs of the organization. And the recommendation from a cost-saving perspective was to have us move to getting a new database completely. Those are pieces that was intended to start in 2020 and continue into 2021 in that budget cycle. And unfortunately, I don't think that it got as far as we would have liked, because being sidetracked by COVID in 2020, and it was not a piece that was finalized by me prior to leaving.
There are no further questions on this section from the committee. Then we will move on then to responsibility for social assistance. Member Freestead.
Thank you, Mr. Chair. In the Auditor General's report, paragraph 12, which I'll read from, it states, paragraph 21, says the manner in which roles, responsibilities, and budgets for the social assistance programs are assigned across ministries may hinder the development of a coordinated and consistent approach. For example, while responsibility for ex gratia payments to seamen and benefits payments to ex-servicemen rests with the Ministry of Community Affairs, it is the Ministry of Finance and Economic Development that has responsibility for enrolling seamen and veterans for medical insurance coverage with Cynical, and the Ministry of Health that is responsible for assisting to meet the cost of their tertiary medical care. Basically, there are 3 ministries involved in providing benefits to seamen and veterans. In the case of medical care for indigents, although the Ministry of Healthcare pays for the care, it has no role in determining the policy or criteria that determine who qualifies as an indigent for this purpose. That function is exercised by the Department of Children and Family Services within the Ministry of Community Affairs. Based on the aforementioned, can you share with this committee some specific issues or challenges arising from the roles, responsibilities, and budgets for the social assistance program being spread across government during your time as a chief officer?
Through you, Mr. Chair, I think that as it related to the seamen and veterans, because the expectation for community affairs was very focused on their benefits as opposed to the medical components, that was easy for us to budget, and we were able to track the numbers and make some determinations about increases. So from a budgetary perspective and from a management perspective, the numbers were relatively small, and so that was easy for us to manage and to budget for. As it relates to the indigent medical, that was always a concern. The budgeting and the funding for that did not fall, rightfully so, as you indicated, within our ministry, and we were contributing to the assessments and working very closely with other entities to determine whether or not the individuals were suitable for these services, but we were not at any point involved with the budget process or how much should be budgeted, and those numbers fluctuated quite frequently. So that was an area that we hoped, again, to have closer collaboration on, and that some of those pieces would indeed have been addressed by the change in legislation that the Ministry of Health was also looking at and taking into consideration, because the funding sat with the Ministry of Health, and then the assessment sat with the Ministry of Community Affairs. So we only played a small role in the process. But the funding and the budgeting perspective, that sat with the Ministry of Health. Closer collaboration would have definitely been to our advantage as it relates to that, because I'm mindful that that's an area that required supplementary funding through that ministry on several occasions.
Thank you, Mr. Chair.
Member for Bodden Town East.
Thank you, Mr. Chair. I want to ask something that I think is quite sensitive, but over and often I've been getting these complaints or expressions that, are we talking about responsibility for social assistance? I don't know what the officers at NAU are trained, or what their backgrounds are, etc. But some persons that enter your facility at the main office get a feeling when they approach the officers, it's a feeling almost like it's their fault why they're in that position. I'm not sure what kind of training, as I said earlier, that the officers are given to deal with this type of customer, if I may say that. But if you could, it would be helpful if you could give me some background as to the training that these officers are giving before they're given that responsibility in dealing with citizens in need. Albeit the country at some point needs to accept responsibility that some of these woes we need to accept, whether that's education or otherwise. But if it would be helpful to the public if you could give me a background on some of the training and some of the skills sets that they're armed with. Thank you.
Through you, Mr. Chair, we had some of the senior officers that had a background and qualification in social work, which was to the advantage of working with the clientele that came through the doors on a regular basis, understanding and appreciating that they came in with multiple issues. And again, as I previously indicated, it was not that when they walked through the door, it was only that their needs was for financial services, and that was it. There were so many other issues that had to be looked at and had to be taken into consideration. Some of them mental health illness. The staff there were not necessarily trained in those specific areas. The staff of NAU obtained basic training, basic intervention skills, but they were not at a level of a social worker. They did not have any specialized training to deal with the more unique clientele that came through the door. They did their best to address the issues and the concerns and to try to work in the most professional way with the clientele that came through the doors, even when those clientele was not necessarily the easiest people to deal with. So again, it was the discussion surrounding whether or not the staffing qualifications and level, because of the nature of the clientele that was coming in, needed to be revised and further looked at and taken into consideration. But training was extended to the staff to better equip them to handle the population that was coming into them.
Mr. Chair, and I thank the Chief Officer for that response. But I guess we can only recognize some of the frustrations, Mr. Chair, that some of these people go through, some of our Caymanians go through, in terms of standing in long lines, the delays, the expectations of things that people think that they shouldn't have to provide, you know. And this is why I think, you know, one of the frustrations, the first frustration is trying to find a ride or transport to try to get to NAU. And then it's the long wait. So hence my reason for always bringing up, and I've been at it for some time now, in terms of, I think that the situation would be less hostile if the department considered opening up an Eastern District office. And I think there would be less hostility when persons recognize that the government is, or the department is looking at their convenience and comfort. So I thank the Chief Officer, and I really want to extend, as she said, some of those customers were not the easiest to deal with. And I applaud the staff of NAU for the hard work that they're doing, sometimes handling situations that they weren't even trained to deal with. And we must appreciate that the job that they're doing is not an easy one. And as Chief Officer said earlier, that around the world and doing her research, you know, social assistance is not an easy thing to deal with, and no one has found a complete cure. But I thank you for that answer.
Mr. Chair, if I may, just for the benefit of clarity, although we were speaking specifically on NAU, I want to share that the community development officers through the Department of Children and Family Services are very much involved with the community as well. And again, to just reiterate that the pilot program as it relates to officers going out into the district would have guided, depend on need and demand, would have guided whether or not we moved into the direction of offices being in other districts. But we had to be able to properly assess that, and from a cost-saving perspective, to know that the needs and demands were there before we incorporated it into a budget process.
Mr. Chair, and I appreciate that, Chief Officer Shaniki. But one of the things I thought that they would have done in terms of their assessment is to recognize that Bordentown, East End, and North Side probably has some of the older persons residing there, some of the older districts. And I think that we should have recognized that there would be more persons in need from these. I don't know what the stats are, but if they look at the fabrics of how those districts are made up, that assistance, and I'm being very careful as to how I mention this, but there's some truth in there, you know, and I think that it is high time now that we considered. I know it's not Chief Officer's, the witness's responsibility anymore, but I will drill down again a little later with the actual Chief Officer of the day in regards to trying to. I think it's going to help them in developing another office in the eastern districts.
Okay, we're going to turn now to the legislative framework.
Before we do, Mr. Chair, I'd like to just ask one further question on the responsibility for social assistance before we move forward.
No, yeah, please go ahead.
I just would like, through you, Mr. Chair, I'd just like to ask the witness in relation to the recommendation number 2. I didn't quite get clarity. Now, I understand you set out a bit of the background on the difficulties that that were set out with trying to incorporate a coordinated social assistance strategy. But I'm just wondering if you could just for my own purposes, if you could just let me know if there has been any progress at all in implementing that. Has there been any start to trying to implement it, or the recommendation for number 2? Facilitating a coordinated social assistance strategy. I'm just curious, as looking here at the report, there hasn't really been any indication of an update. So I know you did express some of the setbacks that you were having, but have you guys made any progress with establishing that framework?
I think that at this point, I'm probably going to say yes and no. On a large and broad perspective, no, there were still much room for further growth and development. Some of the implementation pieces that were done and implemented, moved forward with, and we were monitoring, had to do with the collaborative pieces between the two entities, NAU and DCFS. And so those were aspects that we recognize were critical and important, because the clientele with both entities were very, very similar and sometimes very much the same. Those were starting points that we looked at, and we placed much emphasis on some of the other more broader pieces, because it also included other entities were not developed any further.
Thank you.
Any other questions then before we move on to the next section? Member for Savannah.
Thank you, Mr. Chairman. And this, we're moving on now to legislative framework, and it's in relation to the ex gratia payments to seamen and ex-servicemen. And it states here that appropriate management control frameworks were not in place for social assistance programs. The Office of the Auditor General found that there was no legal basis for paying ex gratia benefits to seamen and ex-seamen, servicemen, and that payments made were based on motions passed by members of the Legislative Assembly. The report also stated that there were no policy or procedures relating to these two programs, and documented eligibility criteria of a somewhat rudimentary nature have been in place since their inception. The Auditor General's Office of the Auditor General recommended that government should develop legislation that provides appropriate authority for programs to pay benefits to seamen and ex-seamen, and arrange for the subsequent development of policies, criteria, and operational procedures consistent with the legislation. The original management response to the recommendation stated that the ministry had revised the criteria for benefits, and recommendations were before the cabinet for approval, and these should form part of the elderly legislation and social assistance strategy. No date was provided for implementation. In the government minute of October 2016, the ministry repeated the original management response. The Office of the Auditor General noted that the Older Persons Act 2017 that was passed by the Legislative Assembly in March 2017 did not include any provisions to pay benefits to seamen and veterans. In August 2018, the ministry stated that the implementation of all Office of the Auditor General recommendations was dependent on the development of a social assistance strategy. As of June 2021, the ministry stated that a member of staff was seconded from the Cabinet Office in 2020 to assist with review of the Older Persons Action Plan and establishment of a senior center to ensure that all services for all people age 60 and over are considered and administered by one ministry. The senior center opened in April 2021, but the review and further development were ongoing. This does not directly address recommendation 6 in the Auditor General's report. However, the ministry's response also stated that revised legislation had been drafted and handed over to the new ministry. Can the witness please advise how the proposed changes to the legislation and how these will address the Office of the Auditor General's original recommendation?
Through you, Mr. Chair, there were indeed no legislation that guided the seamen and veterans process as indicated. However, there were criteria and clear guidelines in terms of how persons were eligible for such services. The secondment by the staff member from the Cabinet Office to revisit some of these pieces were taken into consideration, not only as it related to the legislation that guided the Older Persons Council and some of the action plans that were coming out of that, but also it was to look at the areas within the NAU legislation that was being revised that would also address these aspects. So the benefits for seaman and veteran was included in drafted legislation and regulations for the needs assessment unit.
Thank you very much. I appreciate that answer to that question. Now, this question is in relation to poor relief payments, and it states that the law governing permanent poor relief and temporary poor relief assistance, the Poor Persons Relief Law 1997 revision, is very brief, and that the government had previously identified the need to develop regulations to deal with poor relief awards in its strategic policy statements, although these had yet to be developed. The Office of the Auditor General found that policies and related eligibility criteria had been developed for both permanent poor relief and temporary poor relief assistance. However, there was a lack of comprehensive documented procedures that would guide officials in delivering the programs. The Office of the Auditor General's review of the eligibility criteria identified several issues that called into question their consistency with the requirements of the Poor Persons Relief Law and their suitability as practical guides to program delivery. It was recommended by the Auditor General's Office that the government should follow through on the 2013-2014 Strategic Policy Statement to amend the Poor Persons Relief Law and to develop accompanying regulations so as to provide sound legislative authority for poor relief programs, including the basis for the development of criteria needed to effectively manage the programs. The original management response to the recommendation stated that the ministry had drafted regulations for the Poor Persons Relief Law. These were due to be presented to the Cabinet by June the 30th, 2015. The response also stated that the Poor Persons Relief Law needed to be amended to reflect the overarching philosophy of the social assistance strategy and practice. No date was provided for the revision to the law. In the government minute of October 2016, the minister stated that a policy decision was needed from the Cabinet and that after unforeseen delays, draft regulations were being reviewed by legal drafting, although no date was provided for completion. In the government minute of August 2018, the minister stated that it was reviewing the Poor Persons Relief Law, and this was due to be completed by end of 2018, after which revised legislation would be drafted. However, the minister also stated that revisions to the law were linked to the development of a social assistance strategy for which no date was given. In the PAC hearing in January 2019, ministry officials stated that significant work had been done to revise the Poor Persons Relief Law. They stated that the law was very outdated, inadequate, and did not meet the needs of potential users. On this basis, the ministry had decided to do a full revision of the law with a view to repealing the 1997 law and replacing it with modern financial assistance legislation that included among other things, eligibility, criteria, and appeals process. Ministry officials indicated a draft law should be ready by the end of January 2019 for consultation and debated in the House before the end of 2019. The regulations would follow shortly thereafter. In its 2019 report, the PAC recommended legislation to replace the poor relief law should be brought to the legislature as soon as possible. As of June 2021, the minister stated that despite delays in 2020, a draft bill and regulations have been provided to the new ministry with oversight for NEU to finalize. Could the witness now tell us now what's the reasons for delays in updating the Poor Persons Relief Act and bringing it to the House for debate and approval?
As rightfully indicated, through you, Mr. Chair, as rightfully indicated, the existing poor relief law was significantly outdated. I think efforts were made initially to look at whether or not that could be reviewed, and it was felt that we would be in a better position to reestablish or to establish a complete new piece of legislation. With that in mind and appreciating that we were adding additional aspects to that piece of legislation, it was taking a significant time. We wanted to ensure that the entities involved were very much involved with the process of developing the piece of legislation, because we had to ensure that what was in legislation and what was in regulation was going to guide some of the concerns from an operational perspective. So it took us some significant time for that to be done. And the next step was for us to ensure that public consultation was also taken into consideration. That's a piece of legislation that was handed over to the new Chief Officer and Minister, along with regulations. I know that initially we said that the regulations would follow, but we also had the regulations drafted along with the legislation itself.
Thank you, Mrs. Echenique. Could also you give us some idea of the proposed changes to the legislation and how these align with yet to be developed social assistance strategy?
Through you, Mr. Chair, there was a number of areas that we looked at and took into consideration to enhance operations of the entities that we were responsible for that fell into that piece of legislation. The mere fact that one of the concerns had to do with the timeliness of services was one of the areas that we looked at very carefully in that legislation to ensure that persons did not have significant periods of time when coming in for services, and that their services would be delayed unnecessarily. So there were numerous pieces that were taken into consideration, along with additional services that was not originally included in the poor relief law. And again, the other aspects that we wanted to ensure was covered was the appeals process. If persons were not pleased with the services that they were obtaining, what would be the next steps moving forward as it relates to how could client be empowered to question why they did not get services and appeal that process. So there were a number of areas from an operational perspective that we looked at and took into consideration to enhance services, but we also wanted to know that needs of the clientele as a part of us empowering them was taken into consideration. And one of the other areas that were critical and key, because we had heard on a number of occasions people say to us that NAU is giving services to people, and it's encouraging them not to actually go out and seek employment. And we wanted to somehow be able to ensure that even without employment, if someone was getting services through NAU, they were still giving back to the community. So we incorporated into that piece of legislation a component that spoke about community service. So while an individual was obtaining services from NAU, they could also be required to complete community service. Again, it wasn't on the need-by-need basis, because some people might not have been fit to do some of these pieces of work. But if it was an able-bodied person, those were other areas that we were looking at and taking into consideration.
Thank you, Mrs. Echenike. And I'd like to take this opportunity to say thank you very much on behalf of myself for answering these questions so eloquently. I know your position right now is not in this ministry, but you have done an excellent job with answering the questions. And that was the end of my questions at this time.
Other members have questions?
Through you, Mr. Chair. Just a quick question going on to the draft legislation, since it's something that you guys already handed over to the minister. Can you speak a bit in relation to the regulations? Does that have any proposed change to the way the assessment process will be conducted? Just to elaborate a little bit more in terms of like the net household salary, like does that do the regulations change the formula that has currently been set out? Well, there's by policy, sorry.
Through you, Mr. Chair, we did try to take into consideration, obviously, the legislation itself takes a more broader perspective. The regulations is diving down into some of these pieces that is a little bit more specific. And we did try to take into consideration the fact that cost of living has changed, and some of the baselines that we were utilizing were not necessarily in line with existing times. So those were aspects that we looked at and we took into consideration with the establishment of the regulations. I think that it was necessary for us to get information as it relates to the ongoing cost of living within the Cayman Islands and utilize the statistical information as a baseline for some of the guidelines and some of the regulations that we were trying to implement.
Good. That sounds good. Thank you. Just one additional question in relation to the regulations. Can you also speak in regards to persons that would fall into particular categories? And this goes back to assessment purposes again. For example, an elderly person or a disabled person. Does the regulations set out a different means of assessment for those persons?
Through you, Mr. Chair, the assessment process was more of on a consistent basis, but what we did take into consideration for persons that may have had special needs is looking at what type of benefits they would require that someone without special needs might not require. So the general assessment process, when we talk about assessing the individual, it's to determine whether or not they are suitable for the services and whether or not they have any form of means to support themselves. And those are basic things that would be applicable to anyone that would be walking into the door asking for services. If their circumstances based on confirmation from a medical practitioner indicates that they have long-term illnesses, then that might determine how much services they get, the length of time they're getting it, things of that nature. So the services might change depending on the individual needs, but the assessment process was more on a consistent basis.
Thank you. Just to clarify a little more why I was asking that question is because it's quite burdensome for, in particular, persons who are disabled and are elderly to have to be reassessed every 6 months. And I would hope that the regulations set out something that will make life easier for those persons who are already set back a bit.
Through you, Mr. Chair, the initial assessment and the determination of the person's circumstances, if they require long-term support and assistance, then would be taken into consideration as a part of their services. But the initial assessment process to determine the baseline and to determine suitability is, we try to keep that standard for anyone coming into the organization. But someone definitely with a long-term illness who is a senior, the length of time that they obtain their services would be definitely different. And even without the legislation in place, for some of our seniors are getting permanent financial assistance. And again, that is not something that they have to be ongoingly assessed for. It's not automatically stopped at a 6-month period or at a 1-year period. It is, as it said, permanent financial assistance, so that would continue until they pass. There are times when, for the benefit of auditing purposes, that we will run general assessments to determine, has this person's circumstances changed in any way at all, and just to confirm, yes, indeed, this is someone that is still living, is still in need of services. But for the most part, those are some of the pieces as it relates to the seniors or some of the persons that have been identified as having permanent medical illness. They are already in a position to obtain permanent financial assistance, even without the new legislation.
Thank you.
Okay, let's move on to the next section, which I think you were dealing with, the applicability of eligibility criteria. Yeah, that's where we're now moving to. Thank you.
So thank you, Mr. Chair. So I'll move on to the application of eligibility criteria. The Office of the Auditor General reported that some eligibility criteria existed for each of the social assistance programs. The application of eligibility and documentation to support decisions in paragraph 28 to 29 of the report reported that there were inconsistencies in the criteria being applied to determine eligibility for benefits. Paragraphs 60 to 63 also reported a number of gaps in the documentation in client case files to support the decisions that had been made, and in some cases, the entire file was missing. The Office of the Auditor General recommended that the ministries responsible should take steps to ensure that eligibility for benefits is determined by robust and transparent application of eligibility criteria, and clearly supported by evidence in program files. The original management response to this recommendation stated criteria were in place. However, in response to recommendation 5, the ministry also stated that it was preparing for approval by Cabinet proposed revisions to eligibility criteria. In the government minute of October 2016, the ministry repeated the response and stated that the revised criteria were implemented in September 2014 and in the scope of the outlined business case. In response to recommendation 5, the ministry also stated that revised criteria had been approved by the Cabinet and further proposed changes were with the minister for consideration. In August 2018, the ministry stated that the implementation of all of the recommendations was dependent on the development of the social assistance strategy. This social assistance strategy keeps popping up. It's holding everything up. In June 2021, the ministry stated that ongoing review of the criteria was being guided by the DCO. However, changes were subject to the progress of the legislation. Can you please, Ms. Echeniki, my first question, update on the revised eligibility criteria? Thank you.
Through you, Mr. Chair, the criterias were dependent on the type of services. So they were aspects that we looked at and we recognized that they were a need to revise some of the criterias and some of the guidelines. And as a result, move forward with those pieces. There were other areas that the criteria and the guidelines seemed still very relevant and very strong. The checks and balances were in place, and so we continued to utilize them. But those adjustments were made more as it related to the various services. So there might be criteria and guidelines in place, for example, for the permanent financial assistance that was a bit different from someone that was only coming in for temporary services. And again, these were some of the pieces that were taken into consideration as we also reviewed the legislation itself. The legislation clearly looked at all aspects of the services within the entity, as well as provided in the regulations clear guidelines and the relevant templates that would have been utilized by that entity, because again, I appreciate that there were concerns about the documentation of these from in files and supporting documentations from client to client. So again, these were all aspects that were taken into consideration as it related to the legislation and the regulations itself. And then of course, us looking at a new data management system would have contributed to that process, because we were hoping to have some of these pieces electronically to move away from the paper file process.
Thank you. An additional question in relation, going back to that criteria, can you then give any assurances that the eligibility criteria is being or has been consistently applied?
Through you, Mr. Chair, I would like to sit here and confidently say yes, because I am very hopeful that the team that is assessing individuals walking through the door is going to be very sensitive to their needs and is going to apply the criteria to the individual on a consistent basis. Although I would like to also indicate that I am mindful that that entity was not perfect, and there were times when there were areas that officer, and this is applicable to not only NAU, but to other entities as well. There's checks and balances that we have to go through. An officer that is working with the individual and doing the assessment might have missed something in the process. And so the next step then would be for the senior officer to look at and take into consideration prior to approval. So we're hoping that when one area might have been missed by a staff member, it might have been caught by another staff member. With that said, the checks and balances are there. I am very hopeful that we will have that consistency and it would be applied across the board.
Thank you. I have no further questions.
I know we're getting into the lunchtime period, but if it's all possible, I'd like for us to finish questioning this witness before we do take the lunch break. So in the interest of trying to move things on, Ms. Echeniki, can I just ask you to discuss with us what measures the ministry has in terms of in place to deal with appeals against decisions taken by a particular unit or person who is adjudged an application?
Mr. Chair, we recognize that that was an area where we had some gaps in the system, and that's why it was so important that when we looked at the legislation that was clearly outlined within the drafted legislation. But pending the implementation of the legislation, we ensured that within the organization itself, there were tiers in which individuals could put their concerns and their appeal forward. So it would move if the decision was made at a supervisory level and the individual seeking services was not pleased with the outcome, it could have been escalated to the director for her to review and to take into consideration. Pardon me. The next step, if at that level it was not resolved, then it would come to a ministry level for us to look at and for us to take into consideration. They were legal matters and discrepancies where we had to involve police for investigation, and we allowed the Royal Cayman Islands Police to then take those necessary steps as it related to services that were misused or abused. Sorry. Sorry, Mr. Chair. So to answer your question, although we were expanding on them through the drafted legislation itself, we also ensured that as an interim measure, we had some checks and balances in place at a department level and then at a ministry level as well.
Thank you. And just one final question surrounding that. I mean, it appeared to me, because most people I talked to, having made an application, had a response that they weren't happy with, not necessarily aware that there is a process that they could have for to appeal. Are those is that process communicated on the ministry's website?
Mr. Chair, I'm not certain that it is clearly indicated on the website. Staff members are encouraged. If someone comes in and they're not happy with the outcome, staff members are encouraged to advise the individual accordingly. But I am not aware if it's clearly outlined on the website or not.
Thank you. I'm going to move on now to the operating procedures. I believe there's maybe one or two questions there. Yeah, member for East End, and then we're going to conclude with resources.
Thank you, Mr. Chair. We are well aware of the issues surrounding the reports that we have here, predating new Chief Officer 2015 and onwards, but in the Auditor General's report, recommendation 13 recommended a major overhaul of the procedures and policies to devolve authority and reduce the bureaucratic duplication that was clearly demonstrated in the public hearings may be a better use of government resources. There was no response from the ministry in October 2016 and 18 and none in 2021. But during your time as a CEO, were there any meaningful progress in updating the policies and procedures? And if not, what were the hindrances?
Through you, Mr. Chair, as I indicated, there were some aspects as it related to specific services that we looked at revising policies and criteria to ensure that it was of more benefit not only to the clientele but also to the staff members that were having to go through some of these pieces. I think that, again, we were looking at a thorough assessment on the day-to-day operations of some of these pieces to ensure that when we were making changes, we were trying to make meaningful changes and not making changes just for change's sake, because we did not want to frustrate the clientele in the public anymore by making changes that was only going to make them frustrated or cause further confusion. So some of the changes that were made were done very gradually and were done very, very slowly, but it was with the intent that we not only wanted to make changes to enhance service, but that the changes were, again, very, very meaningful. So there were some areas within the service that we looked at and we revised, and we tried to make it much more user-friendly for the clientele themselves.
Thank you. The changes, we go back to a previous section where it says roles and responsibilities. Those changes that you were making, those meaningful changes, did you have cooperation from any of the other entities that they would have impacted?
Through you, Mr. Chair, again, it was very necessary for us to have collaboration and cooperation from some of the other entities, because I'm almost wanting to say 99% of the time, the clientele that we were working with were also working with other entities, and we were looking at how we could better meet the individual needs from a more holistic perspective. And so it did require us collaborating with other entities. I'm sure you will understand and appreciate that even with some of the changes that we made internally, if another entity did not make the adjustments, we didn't have any direct control over that, but the collaboration was there, and we did our best to work with other entities when we were looking at bringing about some of these changes, and also recommending to those other entities how we could best work together if they made certain changes.
Thank you, Mr. Janifi.
Member for Georgetown South. We're going to move on now to talk about resources.
Thank you, Mr. Chairman. Through you to the witness. Paragraph 68 to 70 reported that services were not always provided in accordance with policy and in a timely manner, and there was no systematic information available. The Auditor General recommended that social assistance program terms and conditions are consistent with the resources available to the government for these purposes, including the resources required to administer the programs and provide quality services. Can the witness say, prior to your departure from the Ministry of Community Affairs, were you satisfied that you had adequate resources to carry out or to administer these various programs?
Through you, Mr. Chair, unfortunately, with us being faced with COVID, and that increased the demands on the entities, to say that we would have had adequate staffing at that time, I cannot sit here confidently and say that. However, what I will say to you is that throughout the two budget cycles, we did look at and increase the human capital for the entities to try to ensure that they were better equipped to meet the needs. Also, because of the increase that we were seeing and faced with as a result of COVID, there were additional staff members brought on. Some of them were on an interim basis and only for the period of time that we were under some major demands, but we also had some that remained with the organization. So we did the best that we could based on the funding we had in the budget cycle to ensure that entities got additional staffing. It is very, very challenging to see because of the increase in demands that we have seen as of late that they have adequate staffing at this point. I can't confidently say that.
Thank you, Mr. Chairman. And this is not a question, but perhaps I would say that in terms of the technology we have today and having an updated database, we may not need as much human capital to carry out these programs and services. So I will address that with the Chief Officer this afternoon in terms of the update on the database and being able to use that in a more efficient way.
And just to add to that, Mr. Chair, I completely agree with that comment, but I think that it's important because of some of the clientele that we have, that we ensure that we have a good balance, because we understand and we appreciate that some people, especially some of our seniors, and this is not across the board for all of them because some of them are very savvy when it comes to technology, but we do understand and appreciate that some persons just don't have the ability to complete forms online or to utilize some of the electronic systems. So having a good balance between the electronic system as well as caring, compassionate, understanding, and helpful staff members are going to be critical with this process as well.
Through you, Mr. Chair, I also just want to make a statement which lines with what the member for Georgetown South just raised. I think it goes back again to the need for that strategic framework to be in place, because how else do you measure whether or not you have enough staff? That framework would obviously, set out who are the clients of NAU, what are their needs, and how do we address them. So I think it goes back to the elephant in the room and the fact that we need to get that addressed.
I wholeheartedly agree with you, member, and I think that's an issue we wanted to air quite extensively with the Chief Officer this afternoon. So. Member from Savannah.
Mr. Chairman, thank you. I just want to make a statement in regards to what the honorable member from Boddentown East mentioned earlier in regards to perhaps considering an office in the outer districts. In my position now as Parliamentary Secretary under the Ministry of Social Development, I have all intentions of ensuring that happens. But I also want to make it known that Cineco just opened one of their offices, or an office in the Savannah community, which has been helping tremendously with those persons from the outer districts, that they don't have to drive into town to deal with their issues at Cineco. So that office in the countryside area has been providing tremendous service to those from the outer district. So hopefully in the near future, an office for Department of Children and Family Services as well as NAU will become a reality in the outer districts. Thank you.
Member for Bodden Town East.
Mr. Chair, thank you so much, and I just want to comment on my appreciation for the permanent secretary for taking this up, and hopefully this can become reality over this term. I know some of the problems that we have in trying to move services to the Eastern District is space, and so I saw that Cynical office there, and I know that is doing a tremendous service to the Eastern Districts, and I thank you so much, the member for Savannah, for agreeing to be the champion for this cause. Thank you.
Thank you, Mr. Chairman. And I'd just like to relay my thanks and appreciation to Mrs. Echenike for being here with us. You've done a tremendous job in answering our questions, and I so appreciate you. Thank you.
I said we were going to conclude with resources, but I realize there is another section here, and that is social assistance payments. And I believe Member for Bodden Town East, you agreed that you would lead off with that section, and then we'll conclude.
Thank you, Mr. Chair. The Chief Officer. In its 2018 report, the PAC recommended the government consider the creation of a standard rate of payment for welfare recipients, whether they are classed as indigents, seamen, veterans, or those receiving temporary assistance. This can be found on pages 53 to 55. In August 2018, the Ministry of the Needs Assessment Unit agreed with this recommendation and stated that they were currently working to modernize enabling legislation in order to improve the efficiency and effectiveness of financial assistance services. This included a review of the Poor Persons Relief Law in order to prepare updated financial assistance legislation. As part of this process, the Ministry and NAU is looking to standardize payments and services in order to provide the necessary clarity required. It was anticipated, Mr. Chair, that the review will be conducted by the end of 2018. Just in June 2021, just a few months ago, the ministry stated that draft legislation and regulations had been transferred to the ministry with oversight for community development to pursue and finalize this process. It also stated that approval was made in the 2020-21 budget to accommodate an increase by $100 per year for indigents, seamen, and veterans in an effort to address the cost of living. Due to the substantial implication of the budget, considerations may be given each budget cycle for necessary gradual increase to these services. I want to ask the witness, the Chief Officer, what provisions in the draft legislation in relation to the standard payment rates?
Through you, Mr. Chair, existing implementation was completed as it relates to services for seaman, veteran, and PFA recipient to ensure that those receiving funding were consistent and to ensure that they were increased, as just indicated, as it relates to some of the temporary services that was as I indicated when I answered another question, that was taken into consideration when we drafted the legislation and the regulations, and we looked at the cost of living to guide that process. As it exists now, we have some level of flexibility in terms of decisions that we might have to override, even though we have standards in place, decisions that we might have to override, because we understand and appreciate that based on the existing cost of living, what might have been a baseline for rental assistance, for example, if individuals cannot find accommodation within that price range, we then have to make some internal adjustments to be able to accommodate the prices that are on the market at this point. So whenever there are changes in the market, we also have to take those factors into consideration. But the legislation and some of the pieces within the legislation is guided by information that is relevant to the cost of living in the Cayman Islands. And we will have to continue to review those pieces. That's not going to be something that is set in stone. Similarly to the PFA and Seaman and Veteran, we have made a decision within the last budget cycle 2020 and 2021 to uplift each of those areas by $100 each per year. And so that is something that from budget cycle to budget cycle we review and we take into consideration. If it's incorporated into the budget, then we definitely will ensure that the clientele benefits from it.
Mr. Chair, I want to thank Chief Officer Echenike for contribution here today and for the answer. I appreciated your assistance and support whilst you're in the position, and even now, as so eloquently you answered our questions here today and agreeing to come on to be a witness. I thank you so much for the work that you did while you had the responsibility. And I know wherever you've landed now, you will continue the same professionalism and quality of work. I thank you.
Are there other questions from the committee? Member for East End.
I don't have a question, Mr. Chairman, but I'd also like to echo my colleague from Bottom East sentiments, and thank you so much, Ms. Echenike, for being here and answering our questions today. Thank you.
Well, that brings us to the conclusion then of this segment of the hearing today. Ms. Echenike, you've been a real trooper today. We've sat here and we've questioned you for nearly 3 hours. And you have held up remarkably. At one point, I have to say, I was thinking of asking, would you like for us to take a break? But I figured you probably want to get through this as much as we do, and so you could get on to your regular work as well. So I just want to extend my sincere congratulations to you on behalf, thank you on behalf of the committee for being here today and for the frank and very honest, I think, responses you have given. And thank you very much for the time today. I know you're in a new ministry, a new role. I just want to wish you continued success in your work as well. So with that, we will conclude the proceedings at this time for the lunch break. It is now 10 minutes to 1. We will reconvene at 2 o'clock and with the final witness for the afternoon. So once again, thank you all, and let's be back promptly at 2 o'clock for us to recommence. Thank you.